It's Heart Month. I'm wearing red for a reason. Someone else wearing red for that reason. Joyce Irwin. She's the new president and CEO of the Community Health Network Foundation. Thanks for being here. Appreciate it.
Thank you very much.
You've been in sort of corporate leadership for as long as you've had a career. Right. Why suddenly the change to not-for-profit?
Well, you know, when I heard the story and heard about community and all the good work that they did, it was a dream job. It's an opportunity to bring together my healthcare experience plus my love of community. A lot of people may not know, when I was young, I was struck with cerebral meningitis and was not expected to live.
Wow.
And out of that experience, I had a real passion to give back to the community. So this is really a dream job of working with an organization like Community and being able to help raise awareness of all the good work that they do.
That's great. Your dream job with sort of a dream event. It is. Unfortunately, it's sold out, but we still have to talk about it. This gala is a big deal.
It is. This is our the inaugural gala. It is this Saturday, February 9th at downtown Weston. We are fortunate to have Jane Pauley, our own Jane Pauley, and Gary Trudeau will be with us as our celebrity couple.
Gary Trudeau.
Her own, as our celebrity couple. They will be there with us.
That's great.
The money, the proceeds that we are raising will be going to raise money for heart disease and for the Community Health and Vascular Hospital.
Great.
We will be using that money to provide AEDs that are medical devices that will start the heart back in rhythm again if somebody has a cardiac event for area schools. In fact, for 16 area schools.
Wow.
Some of them may be Greenwood schools, Lawrence Township schools, Warren Township schools, to name a few. We will also be doing electrocardiograms for student athletes as well.
Whoa, okay. Now, the AEDs, I think I must have been like 8 years ago. I remember going out and doing a news story on the fact that a school was getting one, and then it was like, was this how necessary? It's necessary. This is not a luxury.
Right.
This should be in almost every public place, right?
Right. Should be in almost every public place. And so through the Community Heart and Vascular Hospital, we will be providing that. We'll be providing training for staff at the schools and how to use them. So it's a good partnership that we have with 16 of the area schools.
Now, the electrocardiograms, is that a relatively new program?
That's a new program as well. So hopefully that we will raise enough funds to be able to provide that for the schools.
That would be nice if we could do that and then stop, because every year there's a news story about a student athlete.
Right.
And it would be nice to not have those stories
That's right,
anymore.
and it doesn't need to happen. So through this, the proceeds will be able to do that. So even though people aren't able to attend, the event is sold out.
Oh, I want to see Jane Pauley. Thanks for teasing that.
So even though people may not be able to attend the event that evening, they can still give to the foundation. They can still, there are other things besides heart disease that we support within the network, but they can call 355-GIVE.
Okay.
And they can give, go onto our website, or they could go to the 355-GIVE number at the foundation, and they can say that they want to help support the purchase of electrocardiograms.
It can be that specific and go right to that.
Correct.
That's
they can
awesome.
go right to that, or we're also raising funds for the evening for heart screens for people as well.
Terrific.
With people within the community.
355-GIVE. I love it when phone numbers are that easy to remember. We're going to put that on Indystyle.tv and the link to your website as well. Thanks so much for coming in.
Thank you so much.
Congratulations on your dream job.
I appreciate it.
I think you were made for that job.
Well, thank you. I appreciate it.
Appreciate you being a guest. Please come back.
Thank you.